Hi, Chris and Charles. Thanks for joining.
Hello.
Hi, everyone. Thanks for joining. Uh, we will get started probably just a few minutes after Brian is handling something right now. Rachel and Vicky, I'm just going to put the Miro board link in the chat for everyone in case folks are interested in exploring that. I'm getting familiarized with that tool while we're waiting.
Hey everybody. Looks like we have quorum, counting 9 people at least in the online room here. So, Co-Chair Milne, I think we're ready to start.
Okay. All right. Good afternoon, everyone. With the quorum.
I'm participating. I just can't vote. Okay, bye.
Okay. With the quorum present, the Regional Maricopa Continuum of Care Board meeting is now called to order. As a reminder, pursuant to the Code of Federal Regulations concerning conflicts of interest for COC board members, no COC board member may participate in discussion or vote on a matter concerning the award of a grant to the organization that the member represents. So while we have invited all board members to attend this meeting pursuant to open meeting law, we expect the 5 board members representing COC funded agencies to recuse themselves from the discussion. Brian, if you could take roll call, and once when your name is called, if you could state your year and your organization affiliation, please.
Okay, I would like to call Letitia Brown Gambino, Tim Birch, Jessica Cruz,
Native American Connections here.
Liz DaCosta,
Good afternoon, Liz DaCosta with Access.
Chris Hallett.
Good afternoon, Chris Hallett, City of Peoria.
Mike Hughes arrived in person and he will be sitting in my office today.
Here, present, a new leaf.
Jessica Raymond. TJ Reed.
Hi, everybody. TJ with Maricopa County. I also brought Caitlin here. She's our homeless programs manager at the county and will be sitting in because my last day with the county will be on Friday.
Say it ain't so, TJ. Welcome, Caitlin. Charles Sullivan.
Hi, Charles Sullivan, ABC Housing.
Sienna Valdez. Cricket Weatherington.
I'm here. I'll be on camera when I get done eating, and I work at AHI.
Okay, Danielle Wright. Co-chair Rachel Milne.
Here, City of Phoenix.
Co-chair Vicki Phillips.
Here, Community Bridges.
Great, so we definitely have a quorum. Thanks everyone for being here online today. Next item on the agenda is to acknowledge any public comment. This is the opportunity for board to hear public comment received through the public comment forum on MAG's website prior to this meeting. This may be related to items not on the agenda. All items on the agenda today are for action and will have their own public comment period if applicable. A maximum of 15 minutes will be provided for this agenda item unless the committee requests an exception to this limit. Brian, were there any comments received prior to the meeting?
There were not.
Okay, great. Moving on to agenda item 3, which is the next item on the agenda is a walkthrough of the virtual whiteboard with MAG staff, who will also guide discussion on the priorities the board creates for the 2024 Rank and Review Collaborative to use while evaluating applications.
Sweet. Thank you so much, co-chair, and thank you, members of the board, for joining us today. This is going to be a continuation of the discussion introduced at the last board meeting, really honing in on, just what opportunities there are for the board to sort of set the direction of what projects get funded with the money brought in from the federal notice of funding opportunity from HUD. So I'm going to share my screen to the virtual whiteboard that co-chair Milne mentioned. If you didn't get a chance to participate in it before the meeting, it's totally fine. We will have a chance to go over those brainstorming questions one way or another. So just for the sake of background on where we need to get to, just a brief refresher on the purpose of today's meeting. There are 2 elements that we are going to discuss in greater detail today, one being the what are called the board priorities. Think of those as more or less just a way for the evaluators of all of these projects to have some guidance as to what kind of projects should be prioritized when they're developing their rankings. The other half of this is the interview questions, and those also asked by the Rank and Review Collaborative to project applicants are another opportunity for them to have a better idea from the projects directly, answering some of the questions that the board wants to know before ranking any of them or them receiving funding. Before we dive into anything specific, also want to call out, if you can see my screen, we do have the previous year's priorities and interview questions, as well as the project scorecards available for reference in case we need to refer back to them at any point. So if you do have questions at any point or want to see them, please feel free to either hop on that link that was emailed or dropped in the chat for the Miro board, or you can ask us at MAG staff to refer back to it. All right, any questions before we get started? Sweet, getting a thumbs up from the co-chair, so that gives me confidence. Okay, so we're going to skip past this frame here for now. Contains a couple brainstorming questions that, should we get stuck, might spark some new ideas. But for now, let's move over to this board priorities slide and bam. Look at some examples of what board priorities could look like. You'll see here in the top left corner, these gray sticky notes. This is kind of what we mean by board priorities. So the board would say, hey, Rank and Review Collaborative, something we would really like to see is if new projects are going to get funded, if they have partnerships with health agencies baked into their program design. We would really like to see continuing to fund renewal projects if they are highly performing. Those are examples of what priorities could look like. And with that in mind, you know, you might notice that these aren't necessarily details that would have to apply across the board, right? Something really important to consider for this exercise is that Rank and Review Collaborative, when they are developing listings, the priority listings to bring back to you all as the board, they're going to come back with multiple different options, right? So they don't have to be, hey, Rank and Review, we want one singular listing back that has, you know, X priority, Y priority. They can sort of conflict because at the end of the day, Rank and Review is going to provide multiple back to you. Any questions there? Cool. Cleo, did I touch on everything? Do you have anything to add?
Nothing to add. I think you covered all of it.
Sweet. Okay, with that in mind, want to put it out to board members, see if there are any initial thoughts on what some of these priorities could look like. If any of the examples resonate or don't resonate, that's also helpful. Any thoughts? Floor is open.
So I maybe have a thought on some of the examples. And I apologize to Lynn for not having gone on and put my thoughts onto the mayoral board previously. But having been on the Rank and Review previously and now having been a board member and in my position at the City of Phoenix, I think one of the things I would like to highlight in this go around is PSH just in general. Like, we don't have other PSH in the community. Cities and other governments can certainly fund rapid, but to me, PSH would be funding PSH projects would be the priority. And then to speak to one of the examples you've got on there, the one that says preference to new projects with innovative ideas. I would maybe say my preference, and maybe this will just get the discussion going, but my preference would be to maintain as many beds as we can, unless of course we've got really low performing projects. Sorry, and I don't mean beds, maintain as many funded projects as we can, unless we've got low performing. Sorry.
Got it. Perfect. Thank you.
Liz.
Thank you so much for all your work always. And yeah, sorry for not getting into there beforehand, but you know, when we say the preference to new projects partnering with health agencies, it's my understanding that impacts our score. And so do we have anything else where we've kind of shown areas that impact our score as a collaborative applicant?
Yeah, that's a fantastic question, Liz. Definitely right on the money with the partnering with health agencies. The other one I would say is probably this one in the top right, project serving specifically survivors of DV. You know, there's a lot of mystery still around what exactly we lose points on, but something that we are theorizing is that there's one element on the consolidated application that essentially says, you know, is your community specifically looking to address like gaps in the community with these projects, right? And so what that could look like in theory is taking these board priorities as a way to shape that priority listing in a way that supplements those objective criteria. So if a DV project scores slightly lower than the threshold of others, but it's like a specifically identified gap, then bringing that one up in order to fill the gap, we believe is what would fill that sort of what HUD's looking for in that question in particular.
Okay, great. And potentially covered under the preference for new projects with innovative ideas too. Yeah, I think your examples are excellent too. The only thing I would say for the preference for the first one would be like preference to new and existing projects that, you know, describe partnerships with health agencies, because maybe there are existing projects that want to expand in this area. And so it wouldn't just be a preference to new ones. You know, we are very interested in this space, of course, at Access because of H2O and the need to have additional resources to be able to transition members to for that long-term subsidy. But I think also like we're gonna see a lot of progress in the space of HUD programs, you know, paying more for rental assistance and then partnering with Medicaid agencies for the supportive services. So hopefully, you know, in the future, we have less HUD COC programs paying for the support services because we have a more robust support service delivery model within the Medicaid system. So this, from my perspective, is just a way that we can kind of start to pave that pathway, is by having this in all applications and prioritizing it.
I guess to that point, Liz, would you suggest there's some element beyond health in particular and more to just projects with like braided funding or alternative like streams of income?
I wouldn't want to box us in just yet, but so I think kind of starting vague with this new and existing projects that partner with health agencies. It's a good starting point, I think, from my perspective, without like forcing too much into one area. So I think this is enough for now, but thank you for that question. I don't know if others have any other thoughts on that though.
I was actually thinking about that. This is Cricket, this morning, about how do we talk about, well, I don't know how you have a, other than to say it like this, that we want to make sure that we're leveraging this money with other money, that we are intentional about whatever. Right now I think we're talking a lot about access, but I think there's other places at different times where that shows up. And I want us to be very aware of how not prioritizing could actually also risk that funding success as well. But I don't know the right wording.
Yeah, this is TJ. I agree with Cricket and would also kind of maybe parse these two things out slightly. And that one is talking about engaging with other systems of care effectively. And one is talking about leveraging other funding sources to sustain the efforts that we're doing. And so I think both are equally important, is finding supplemental funding sources, whether that is with government, non-government, private, whatever, as well as our projects that are focused on, hey, how do we integrate with other systems of care, especially, you know, as Liz mentioned, the H2O effort, which is pretty rare for states to have the opportunity to, and it would behoove us, I think, to ensure that that is successful so that we see greater investments overall into the homeless system. So just food for thought.
I'm curious if this leveraging of supplemental funding is something you would want to preference in terms of how Rank and Review is thinking about applications, or if it's just more of an idea that we as a community need to be thinking about.
This Cricket, I don't have, I haven't looked at what the application exactly looks like. If there's not, I would say yes, as long as there's a way to concretely measure that. Like, how would we be evaluating that would be my question. Is there a way to do it? And how would we, what is enough leverage and all of that? I mean, I think it gets sticky, but yes, I think it matters.
So in practice, what it could look like is, you know, it's not as though there's anything specific on the application that you know, asks about it. However, it could be that in a general program description, or really any of the narratives, it could come up at some point. And so with one of these being a priority, it would like flag it for Rank and Review in a general sense of like, okay, this project is meeting one of the things that the board addresses. So we should take a closer look at it, or you know, prioritize it in some way. Cool. Any other thoughts before we cover a couple targeted questions? Cool. You guys are great. This is so good. Okay. Just want to make sure we're hitting. Oh, sorry, Chris, did you have a?
Yeah, I do. I just was wondering if we had a sense on the number of agencies not performing well that we might look to replace with new.
Yeah, great question. Not quite yet. And, you know, I think to some extent, there isn't necessarily a exactly defined threshold of like not performing well. It's kind of everything in relation to each other at this point. I will say there is usually a after the scoring process, a like a cliff, so to speak, of high performing agencies, and then a little gap, and then other agencies. So that might sort of answer the question.
And I would say in the last few rounds, we've had what, 4 renewal projects usually end up in that tier 2 category or below. I think that is not confirmed. I can look at our last year's priority listing though.
But that's helpful. Thank you.
Great.
Dylan, can we do a quick time check? I just wanted to emphasize to folks on the call today that we are hoping to get a vote on the, Dylan, Cleo, jump in here if I'm getting this wrong, but on the examples provided and then the ones that were added. The goal was to be able to use these to, or to have these available for agencies as they're beginning to apply in the coming weeks, which is why we're having this meeting now, as opposed to the end of August when we meet with our normal board meeting. So just wanted to put that in everybody's mind. The goal is to come up with some conclusions and make some decisions on this meeting.
Thanks, Brian. Our resident expert at everything, Cleo Warner, is synthesizing this information on the back end. So in just a minute, we'll bring up you know, summarized versions of what we've looked at so far to sort of refine them a little bit further, and then hopefully be ready for a vote. Cool. Okay, so honestly, I think of these brainstorming questions. Want to say most of them have been addressed in the conversation so far, but want to put them on your radar in case they're like anything else comes up, thinking about them. First one, what gaps should our community address with the NOFO? When projects are scored similarly from the project scorecard, the objective criteria, what would you rather have? Would it be a renewal project or a brand new one? Next one, are there specific housing interventions our system should prioritize? Are there specific populations our system should be supporting? And then anything else that rank and review should consider.
It's Cricket. I have a quick question.
Yeah.
If I can remember what it was. On the DV, I was looking through the discretionary points and all that. Is it for specifically only DV, or some places do DV intervention as well as other stuff? Is this scored based upon their demographics and they have people reporting that they've experienced domestic violence, or is it for specifically people fleeing domestic violence? Is there a distinction?
Yep. Are you referring to this over here on the project
Yes.
scorecard?
Well, and on the sticky note too, on the Miro board, it said that was one of the things, that one of the examples, and that we had talked about it around points, in the application. So I'm just wondering, is it specific DV shelters? I mean, DV, like whatever, people housing people who are fleeing domestic violence, or is it broader scope than that?
Right. Yeah, great question. So this is specifically for projects that are exclusively serving victims of domestic violence.
Do you know what do we have right now? Do you know? I should know this, but I don't remember.
Funded by the COC.
Yeah.
I believe there are 2 projects.
Okay. I knew of at least one, but okay.
Yeah, there are 2 projects. They are both, rapid rehousing projects. Well, actually, I take that back. One is a joint rapid transitional housing program, and one is a rapid rehousing program.
Okay.
Do we have anything like, I know we have a separate, like a DV coordinated entry wait list now too. Do we have anything that kind of talks to, or maybe we merge them, I'm not 100% sure, but do we have anything that kind of talks to like the number of individuals in need of an intervention compared to like the amount of resource to help us look at like, should we be prioritizing DV more in our system?
Liz, I would say we're working on that. The kind of bigger system model question, I think that's part of what we're working on this year. We're hoping to have something like that in time for scoring. I think that might be optimistic. I mean, it's a big question, obviously. I think part of the goal, again, Cleo, Dylan, you're sort of the architects of this, but I think part of the goal is just to give us more latitude as we discover that there are things that are specific needs.
Okay, yeah, totally understandable too. So, but thank you.
Sweet. Okay. Unless there are any other ideas, I think we can move on to looking at the draft version of these priorities. Cleo, would you mind sharing
my screen?
Mm-hmm.
Yes. So, here, I can share this Word document that might be a little, hold on, sorry, Zoom has been so funny for me today. Here we go. So We have here a Word document so that it's like a little less busy for us. I have written down what I heard were primary priorities for us today. So this DV one kind of still in question. We talked about it, but I didn't hear it as like directly like, yes, we do want to preference this. But here's something for us to react to. Here's a list. Think of this as what would be provided to the rank and review collaborative. They're looking through all of the applications. These are basically the North Stars for them, aside from the hard numbers in which get scored. Rachel, I know you have been in rank and review before, joining the board. So if you have any like additional input on that experience, please feel free to add it. But how do we feel about these 5?
Yeah, and Cleo, thanks for saying that. I will just say and I don't know if maybe there are other former rank and review members on the line, but my experience is, after that initial ranking, where we do all of the committee does all of the scoring, they take these preferences very, very seriously, like every one of them, and go through that list with these. So it is super important. We provide nice, clear direction, and I just know how much they value having that direction when they're putting together the list for us when they review the project. So thanks, Leo.
And if there are a couple of these that you're like, these are the most important ones, these are sort of secondary priorities, that's also really good to point out. If there is any ranking in this, or if they're sort of across the board, we want to see lists with each of these ideas, then that is helpful as well. But that's the type of feedback that would be useful.
So I don't know like how like descriptive we get in here either though, but I mean like, so if I'm thinking about like a rank and review committee, and if I see a project that just like describes partnering with healthcare agencies, is that like sufficient enough? Or do we say like preference to new and existing projects that clearly demonstrate care coordination efforts with a member's healthcare agency? It's just like, how do we give them some criteria to form their review around this particular one?
I would say in the past, these have been fairly vague, but any description like that you can provide, I do think would be helpful. So like, yeah, even that sentence, like clearly demonstrating care coordination efforts. That's useful for sure.
I like that one. I also think there's something to be said for being aware of balancing cost with the number of people served, right? Like if you're serving less people and you're serving a whole bunch bigger budget, maybe you have great outcomes because of that. And like, I don't know how to balance that, but I don't want us to lose beds in this process. Even though Rachel said we're not talking about beds, I know in the long term, like it's a place for someone to be, however we're going to call it. So I would prefer to see us not lose. What are we saying?
So I'm hearing you kind of also say, Cricket, that you have a preference to maintain renewal projects and less low performing, and also considering costs.
Yeah, like, yeah, I think that it's, I mean, I think we can't take out some of the, oh, you guys, peanut butter sandwich wasn't a good idea. What's the opposite of the actual data? They should be considering what the value for the dollars in how many people we're able to serve. Does that make sense? I don't know. There's a word. Subjective, but that's not really the one I want. The other one, the other word, not subjective.
objective?
Yes. Some objective, and I think that's what scores, but in the long term, if they bring us back something that has cut the beds or places for people to be by a third, I'm gonna be stressed out by that. Unless they're all really sucky, and then that whole, I mean, not the people, not, you know what I mean? Like, unless they're not performing. And we
Cricket, would you say that this sort of captures what you're feeling?
yes.
Great.
See?
Well, what if though, just they're like very high performing, but it comes at a cost?
Well, that's what I'm trying to say. Like, how do we balance that?
Yeah.
I just think it's by having both of those as priorities. Like what we have done in procurement before is focus on like both our scoring points, right? It's feasibility and cost efficiency pairing with performance so that like you're scoring for both. So if somebody does spends, you know, $1,000 per client versus $5,000 per client and their performance is really great, they would have high scores in both of those. But if they have, you know, $5,000 per client, but have the same outcomes, they're going to score high in performance, but maybe low in that cost efficiency or feasibility. So I would agree that both are important, and we would just score both maybe equally or something to ensure that people are getting acknowledged or rewarded for both of those factors.
So I'm trying to think about like that rank and review committee then, and they've got like operationally, right? Like they've got high performing providers and differences in cost. And so they would just basically like, as long as you scored similar for your performance, your cost would just drop you right below the one above you. But so does this articulate that enough for them?
So chances are each of these kind of tells a different story that could be used for a different ranking, or like a different priority listing. The third bullet, the reallocation one, that might just be used as justification when they come back to the board saying, we want you to reallocate this project because it was not cost effective. And so I think, Liz, the answer to your question is it could communicate that for like one of the specific priority listings that they bring back.
Okay. And are these in order of priority?
They aren't right now, although
Okay.
they could be. It's up to you all. As I mentioned, since they, you know, could be different things, not necessarily like all at once, it's not entirely needed to rank, but is an option if like the board feels strongly about some of them. All right. Any other thoughts or discussion on these 5 priorities listed here?
I think on the preference to permanent supportive housing projects, that one's like, I get it. But we also have like our rapid rehousing projects that we work on move on strategy with too. So what is the intent here? Like, because if 2 projects come in scoring at the same level and they're in tier 2, right? Like, or is that we would have a rapid rehousing project go in below a permanent supportive housing project?
And Liz, I'll just speak up because I added this one and I'd say yes, because we don't have as a community a lot of other opportunities for permanent supportive housing, but we do for Rapid with other funds available. And so my preference with this funding source is to prioritize PSH over Rapid.
Okay, yeah, that makes a ton of sense then. Okay.
And yes, effectively, rank and review would provide this to rank and review. And if they were stuck between things, they would look at this and say, well, the board wants to prioritize PSH, so we are putting that project above the Rapid one.
Yeah.
Alrighty. I think if there aren't any other thoughts, I'll pass it back to you, co-chair, for a motion.
So Dylan, do you want to put them in order or do we want to just leave them as is? And
Up to you all. I mean, like me personally, totally fine with either.
board, how are we feeling about it? Do we want to, is there something that jumps out at you? There is to me, but I'll control everything. Like, to me, the consideration of reallocation for renewal projects of low performing or not cost effective is would rank pretty high as far as all of these things, but just want to see how you all are feeling about it, or just want to leave them as is.
That one jumped out to me too, Rachel. I agree with you.
Thank you.
That one scares me a little bit because, of course, but because, you know, it always bumps up against like new projects who say they're going to come in and do this great job, but haven't actually gotten to work at all.
Yeah.
And so you end up like scoring somebody off their dreams rather than their implementation.
Yeah, that's a great point, Liz.
And then we end up having to figure out how to get those rents paid for people that aren't funded anymore, which
Right.
causes housing. So to me, that one, I like that one, but I think it should be tied to the one that we just coordinated. The long one we did. I don't know where it went.
That is the one you just did, right? The cost effective, the one you kind of helped spearhead for it.
Yeah, so we took all the rest of it because I missed that part of the typing. So that one, yeah. Okay, hold on. I don't think that's, to me, that's not the toppest priority though.
What's your top priority?
PSH.
This is so tough. My top priority is the healthcare partnerships, of course, because it's going to help us score higher as a collaborative applicant and leverage other resources within the system. So if you had like a renewal project that came in and talked about this, but was low performing.
Liz, I agree with that, especially because there's such a national effort by HUD right now to really link in healthcare agencies and braid together that funding. I think that makes sense.
I will say something you could do is in here, let rank and review know we absolutely want to see these three priorities reflected in 1 to 3 priority lists. Like it might line up where you get all of them in one, or it might be that there need to be 3 separate lists reflecting each of these priorities for the board to reflect on and ultimately vote on at the board meeting.
So this kind of like tiers it out a little bit where those top 3 are like board priorities and the bottom 2 are like board considerations.
But in no particular order with the top 3. Okay.
Or, yeah, because then they could do the 3 lists. That, I mean, I'm fine with that because I also could be convinced that either of those other 2 things. I think when you're in it and you're doing the review, you're so paying attention to the nuances and whatever that like some of them will fall into all or none of those categories, right? That will still probably be funded.
All right.
Oh, you go.
Well, I was just gonna say if this list is looking pretty good, that the 3 in bold are sort of more board priorities, the 2 not bold are considerations, but not in any order. Would anyone be willing to make that motion?
Before we do we have definitions or metrics for what it means to be low performing or not cost effective? We do. Okay, then yes.
Well, no, I mean, I can only say low performing is that, and Dylan or
Cliff that you talked about.
the cliff, but do you want to talk about how we would consider cost effective?
Sure. So really, we would just have the Rank and Review Collaborative look at the budget of the project being proposed versus, you know, the amount of people they serve.
I have a question. So I definitely think the first bullet, it's not necessarily a rating preference, right? It's just our overall preference. We'd rather have higher producing and more effective than lower. So given if we're able to provide a separation, and I think to earlier discussion, it'd be nice to know which existing or renewals and or new ones had the second and third bullets to help make the determination. You know, it may be low performing, but do we want to hurt our pricing or preferences overall if we're taking out a health agency or a PSH? So I think part of it is scoring them all as is, knowing which are renewals, which are new, and knowing that preference. You know, we're not going to take out something that's a high producer just because of that preference or vice versa. We don't take it out. That would be for me is we want to keep the best of the best, obviously, but also the ones that are going to just help our score overall. And I think that first bullet just comes into play is very subjective at the end when we start seeing that. I know you'll do different iterations. If I remember, we might have had, I don't know, 3, 4, 5, up to 7 last year on how you spun it, just like Cleo was saying, depending on what list you look at. So I don't want to put too much emphasis on the first one because I think it's just a general theme that I think we all would agree to. Having said that, we really want to have emphasis on the second and third, both in renewal and or a possible replacement.
I'm just glad I'm not sitting on this committee. Because I think this is really hard.
So fun though, Cricket.
I know. Well, I offered, you know, but
Yeah. So Chris, just to make sure we have down here what you would like to see or what would be helpful to see is ensuring that with each priority list, there are notes pointing to the specific projects that are falling in these categories.
Yeah, the second and third ones.
The second and third ones.
Yeah, because I think the first bullet is just an approach, or maybe a different version, right? And we say we look at one without those preferences, because I know you do a clean, straight up one, and that's always very helpful. It's just that's our beginning point. And then if you look at, say, the second one, here's the ones that are flagged, like you said, that have either the second or third bullets in them, and you get to see where they were in the original one, and then you figure out, well, okay, what's that preference point differential worth? And is it worth that consideration? And back to an earlier point of the risk of a new one versus an old one. Well, if we already determined the old one's not performing well enough, it's not much of a risk if we're going to get either PSH out of it or a health agency out of it. Conversely, you might not want to give up on them if they have one of those 2 things, even though they're low performing.
can I ask a question? To Rachel or staff. With these priorities, what's the worst case scenario you could see happening? Like, could this lead to, okay, we're just going to defund all rapid rehousing? I mean, I just want to be clear, like I want to be thinking on the other end of it, like what are we? Because I think there's something about we want things to get better, and also complete upheaval is always not the best thing either. So like, how do we balance that? What's the worst case scenario?
I would say, I mean, this is pretty safe. I don't think we are doing anything that would upheave the system here.
Want to make sure.
Historically, it seems like there's a tendency to keep renewal, especially new renewal PSH above all else. And this low performing and cost effective piece might be an extra help this year in order to get some of that turnover that could be really productive for the system, as opposed to holding on to everything all the time. Because then there are times where we get low performing projects just getting pushed through because they are PSH. So if anything, I would say this is moving us in a potentially more productive place of using our funding in a more dynamic way.
Dynamic, that's a beautiful word.
To follow up on that, is there a score related to performance?
There's lots of scores related to performance. Okay. So Dylan can navigate us to the scorecard again to look at that. But basically, that first list that you see, Chris, every year is performance, like very yes or no, you got these points, you didn't get these points. And that's sort of what we would mean when we say low performing, is your score itself was just really low on the outcomes that your program produced.
Yeah, I'm just trying to, I think that's a very valid table to have when we're looking at all this, because it may help us when you're trying to offset, to your point of a PSH that's low performing. You know, at the end of the day, the total points matter, I think, when we're being considered, and how many high performers we have in a high priority area, so that we don't, again, I think the point differential is something that we need to consider when we're looking at these project lists, prioritizations.
Yeah, and you will, on the priority list, have those total points for performance next to each project name when this gets presented to you at the board meeting. So you'll be able to see like, oh, that's, maybe a PSH project working with health agencies, but they have a score of 60 when everyone else in PSH has a score of 90. So that'll be something you'll be able to see when you're reviewing it.
I know we can't change the scorecard, but just for like a parking lot for next time, is maybe that's where we put the cost effectiveness is in the scorecard, because it seems like it makes it a little bit easier to measure for ranking review.
Absolutely. Something to also think about, even though scorecard is set, the interview questions can also supplement what isn't included in the scorecard. And I believe we'll be pushing that discussion back a little bit. Some more time to figure out how that could work.
Do you think you could pull up the other thing? I want to make a proposal.
The list of priorities.
Yes.
Yeah.
Just to clarify, the scorecard, that's our scorecard, or is that HUD's scorecard?
That's our local one. So the board.
How do we cross-reference what we're scoring and prioritizing versus what HUD wants?
Yeah. So that's a great question. There are, I don't know, it gets a little tricky. So HUD doesn't necessarily see each individual project application that comes through. We put together and send them like the final priority listing that has all of them. So for MAG and the consolidated application as a whole, it's really our responsibility to make sure that we're addressing what HUD is looking for in not just the projects that get funded, but also what we're doing as a region to address their priorities.
And I might have lost my amazing recommendation.
Oh no.
I'm totally joking. I'm totally joking. But I do think that, like, if we think about priorities for the board, right, that the preferences make more sense to me, as like these are our priorities, kind of similar to what Chris was saying. And then the other is like something that we welcome the rank and review team to consider in their scoring is the reallocation of renewal projects if they're low performers or not cost effective. But I do wonder if we can bold the preference to projects leveraging supplemental fund sources, but add to expand resource capacity or something that kind of gives them some more clarification. Like, we're not just looking for the fact that you like get food boxes from St. Mary's, right? Like it's your leveraging of resources that actually brings more units or more resource into the community. And so those would be like those are my preferences for our projects. Like the gaps I'm hoping that we can fill within our system will be those three that are bolded now.
Does this reflect what you were thinking, Liz?
Yeah.
Dylan, one thing that I heard Liz say that I think is really important is that like resource capacity into our housing system, like not as kind of, if we can kind of make that really clear, like the way Liz said it, because it's not just folks are getting extra points if they're, utilizing food boxes and what have you. Thank you.
Say homeless system, just so it's real clear.
Unit capacity. Put unit or some kind of capacity so that it's more than. Because I could write a really whole good 2 pages on how getting a food box makes it successful. And I could tie it down into the social determinants of health, and that would be that. And so I think it should be really specific.
But also funding. Oh, well, I guess it says funding resources.
Yeah, okay. So it's like capital, not capital in like building, but like cash.
Preference to projects leveraging supplemental funding to expand unit capacity for the homeless response system.
Nice.
Yeah, and don't get me wrong, food is very important. These are like limited dollars that can actually pay for a unit somewhere. So that's what we're trying to get to.
That's exactly what I think. That was a great clarification.
All right, how are we feeling about possibly maybe someone making a motion on this list?
Liz.
I'm the worst at this. Like I move to approve these as the board priorities for the rank and review committee.
I second.
Yeah.
Thank you, Liz and Cricket. So we will do I think we're going to do a roll call vote on that, right, Brian?
Yes, I'm going to exclude folks who are on the call, but are receiving funds from the COC through an agency. So here we go. Chris Hallett.
Yes.
Rachel Milne.
Yes.
TJ Reed.
Yes.
Cricket Weatherington.
Yes.
Elizabeth DaCosta.
Yes.
Tim Birch.
Yes.
And Jessica Raymond.
Yes.
I think we have everybody accounted for, and I think we have not heard any no's.
All right, so motion passes. Thank you very much. Moving on to item 4 on the agenda. I know, Brian, I don't know what you want to do. We had scheduled an hour and we're at an hour. Are we moving forward with the interview questions?
As Dylan just said, I think we'll postpone these.
Okay.
The critical one to get here was the priority so that we can have folks who are applying for this funding through the NOFO process, submitting their applications, they can now refer to these. As for the interview questions, we can put those off until the board meeting.
Okay. All right, then I guess with that, this meeting is adjourned. Thank you everyone for your time and commitment today, and we'll look at the interview questions next week. And a huge thank you to Dylan and Cleo for walking us through all of this and your patience with us, since we didn't give you any Miro wall stuff prior to the meeting. So thank you. Thanks, everybody.